Hey guys, and welcome to today's live stream. We're going to be talking about tendons and them healing. Hopefully you guys are going to find this really helpful, particularly if you have a sort of more chronic tendon injury, or maybe you've just gone back to work, you've started that word processing again, and you're starting to get a bit of tendonitis in the arms. That can be a real trouble. So hopefully you guys are going to get tons of value out of today's live stream. As always, if you are new to the channel, please do consider subscribing. We do these live streams every single weekday. Today is going to be no different. We've got Lara the other side of the camera. She's going to be reading out your questions for the Q&A section at the end. So if you've got any questions about your back pain, about tendonitis, about anything that we're covering in today's live stream, or a few other issues and bits and pieces, then please do post us in the comments below and we will get to those towards the end of the live stream. With that being said, let's get into today on tendonitis. Hi again guys, so today we're going to cover sort of a bit about the tendons and them healing, especially with relevance to the sort of the more longer term tendon injuries. So if you've got sort of a tendon rupture, a family member that was playing squash and completely snapped the Achilles tendon, as in it went into two parts, the calf rolled up the back of the leg, and that was that. So this isn't really for you if that's you. You know, you're going to need to get that tendon knitted back together again. But those of us that struggle with maybe a bit of tendonitis, as I mentioned in the intro to the video, having returned back to work, or maybe a bit of Achilles tendonitis from your running, or we've got some tendonitis around the hip muscles, maybe from chronic and long-term back pain. We're getting the nerves are signaling to those muscles to contract all the time, and it's starting to wear on the tendon. This is going to be really for you. We're going to go through a little bit of a recap. Yesterday, maybe you didn't see this, maybe you're watching this in the future, but yesterday we covered collagen in particular and a bit about the healing times of ligaments and tendons, more so focused a little bit on the ligaments, I would say. But we're going to recap a little bit of that and then get into a bit more of sort of our experience of dealing with these sorts of things in the clinic and some practical advice and guidance for you guys towards the end of the live stream. So hopefully it's going to be really helpful. Just to sort of run over the first bit. The structure of the tendons, they contain collagen. It is primarily going to be type 1 collagen in this particular scenario, and they've got a very poor blood supply relative to other structures like the muscles. So that's one thing we want to have in mind. They're metabolically less active because they just need to be essentially a conjoining structure between the bone and the muscle. They need to not move too much in terms of stretching, and they need to allow the muscle to exert its force on the bone and then subsequently the joint. So that's a really sort of important thing to bear in mind. When we injure them, especially these sort of minor injuries, they go through those same three phases that we covered yesterday. We've got the inflammation phase, which is going to be that 48 to 72 hours. Really important. Again, we talk a lot in these live streams with relation to back pain about controlling the excessive inflammation, and that is something that we definitely do want to do. But when we first injure it, unnecessary control and suppression of any inflammation whatsoever does have a negative impact on healing. So there's that fine line between, you know, getting over the top in there with maybe excessive protocols when we first injure it and stopping inflammation. But generally speaking, most of you, when you first injure that structure, it's not that you're going to go and seek out some of these more invasive, more targeted anti-inflammation processes. So most of you will go through that normal initial inflammation process, which is your body laying down that clot in and around that injured tendon. Maybe it's up here on the elbow, for example, laying down that clot, and that's going to secrete that growth factor, etc., which is going to help direct more resources to that area. And then once we go over past that 72-hour period, that growth factor is going to be stimulating those local cells to secrete more of the necessary materials, collagen being one of them, to go through that healing process. And that's going to take a couple of weeks. And then the remodeling, which is realigning those collagen fibrils along the stress lines of that tendon. That's going to take place over the subsequent number of weeks to months. So that's kind of a whistle-stop tour of the healing process in these tendons. And obviously, depending on the degenerative change, more or less, there's going to be a slightly longer or a slightly shorter recovery time. But we really wanted to cover a few very pertinent points around the actual tendon injuries themselves. All too often we get patients that have injured the tendon through, we're talking about repetitive stress here, and they're constantly going, oh, it really hurts here, and they're digging in at the elbow, and oh, it's really sore. And you just maybe, I've even had a scenario where you do a treatment and the patient goes, oh, that feels better, and then they start poking it. Why is it doesn't hurt anymore? And I've had this one case in particularly stands out to me. We were helping a friend who'd really been struggling with tendinitis from writing for long periods on the computer. And we did the work with the laser, and he was just shocked and just constantly pressing it. And that constant pressure then goes and re-aggravates the tissue. So we need to kind of, to a certain degree, leave these alone. That is very, very important. All too often we're focusing on where this area is, where some of the pain is, and actually we're completely missing out on some of the muscle bellies, which is what I really want to talk to you guys about today. Because when we've got a tendon, we've got the muscle on the other end, or attaching to it. So we've got the bone over here, we've got the tendon structure here, and then we've got the muscle here. And what's happened is we've got a weakness here, and all too often people say, oh well, there's pain here, so they start pressing on here. So we don't want to do any of that. That's quite important. So leave your tendon injuries alone. Stop pressing them. The second thing is the muscle, where you think, oh well, it's tight, the muscle's tightened up, which does happen. We get a little bit of pain here, we start to tighten up our muscles. They tend to create further issues, and if the muscles become tight, they're going to pull on this tendon, which again is not going to be advantageous for that recovery process. So that's important to have in your mind. We've got a tendon injury, we've got some tendinitis, maybe it's in the hips muscles, maybe it's in our forearm, maybe it's in our Achilles. We don't want to start pulling that muscle even more, because that's going to negatively impact the recovery process. Instead, what works really nicely is follow along the length of that muscle. So from the tendon here, following along, or maybe it's the hamstring where it's attaching in at the buttocks, follow down to the middle of the hamstring, and then we can either do some gentle massage work there ourselves, or we can employ tools like this. I know many of you guys have sort of the vibration units at home, or you've got massage things that you've had in the past. There's loads of them that have been out over the years, and we just then go down along the muscle here, not right where the tendon is potentially particularly sore, because what that's going to do is help ease off and relax off this area here, so it's not pulling as tightly, not pulling as hard on that particular area. So that's a really big one for you. We see this I see this a lot in the sort of the standard approach that say marathon runners, etc., would have, where they're running lots, they're doing lots of activity. And I just had a quick glance at some of the research over on the topic of Achilles tendon injuries, and it was somewhere in the region of, I think, 25 to 40 or 25 to 30% of amateur runners will get tendinitis issues because of overtraining. Not undertraining, overtraining, so too much training on these muscles, not giving them the tendons time to heal. But it will go for a 5K, a 10K run, the tendon gets a little bit sore, a little bit strained, a little bit injured, which is okay. But then you finish off and you're putting all that weight through the tendon to really stretch out the muscle afterwards. And we cannot put a longitudinal stretch through this muscle without pulling on the tendon. So if you're someone with a tendon injury, please, 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 in those early days, really try and avoid, especially when we're talking about the calves or some of the lower limbs, putting your whole body weight through that tendon to try and stretch the muscle, because we do want the muscle to relax, but stretching the muscle via the tendon is the only way you can do it, and it's not going to be helpful. So work more on the massage principle. If you've got tendinitis, no matter where it is, massaging the muscle belly away from the tendon to keep it as pliable as possible, so that the tendon can have that respite it needs between sort of episodes and flare-ups. So that's a very important one to bear in mind. We touch a little bit about icing, or we touch a lot on icing when we talk about back pain and making sure you guys control that excess inflammation. One thing to really bear in mind is we don't want to stop too much the inflammation process here. And bear in mind, when we're talking about the lower back, we have you guys can see down here, we have the bone here, and maybe it's the disc, and we have the spinal column, the nerves are in here, and then we've got the spine, then we've got the muscle over here. You're putting the ice over here. It's basically a mile away, okay? So when we're using that ice on the back, we've got a lot of depth of penetration to actually get that ice to where we want it. When we're doing ice on a lot of the tendons, they tend to be a little bit more superficial, closer to the surface. So slightly lower icing times. We just want a bit of stimulation with the cold to create a removal of blood circulation from that area temporarily, and then a flush back through just to get rid of some of those waste products. So that's a very important one. Don't necessarily do the ice for as long as we recommend on the lower back if we're talking about tendon injuries that are closer to the surface. Please don't forget that, otherwise you might make things worse. So very important note there. Really, this is about self-treatment and treating at home. So these things you can all do from home. There's one final one I want to get into before we start talking about some of the other little bits and pieces around here that you want to bear in mind when we're talking about more chronic or long-term tendon injuries, and that is the drainage. One thing that does definitely help, particularly when we're talking about these sorts of issues in the forearm, is a lot of us are really congested when we've got these round shoulders. We're working for long periods on the computer, so we get a lot of stiffness through here. That has a negative impact on the circulation in this area down here if we're talking about arm-related tendinitises or tendinopathies, so the tennis and golfer's elbow from repetitive work or from tennis and golf and other activities like that. Doing a little bit of work, like one of the chest stretches that we've shown you guys before, lying on the back to open out the rib cage here, does help with reducing the inflammation and improving the drainage in this area, reducing the out of control inflammation and improving the drainage and removing some of those waste products from this area so that the necessary local cellular environment can be maintained for the appropriate healing to take place down there. So a little bit of mobility work at the girdle can be helpful for some of these limb issues. So if we're talking about Achilles tendinitis, keeping those hips nice and mobile. If we're talking about tendinitis in the forearm, keeping that shoulder nice and mobile, and doing a little bit of just work to open those areas out, some gentle stretches can really help in combination with a little bit of icing here and a little bit of local massage work. Now, when we talk about treatments and those sorts of things to help these things recover, these tendon problems recover, then we're looking at things like, we obviously do laser in the clinic, but generally that's going to be an adjunct. A patient will come in with back pain, we're helping them with back pain, and they've also got a bit of maybe a tendinitis in the shoulder, or they've got some tendinitis in the arm or the Achilles, and we'll do a bit of extra work there, and it does work really nicely. Depending on the chronicity of that tendon problem, it takes more or less applications, but it can really, really help because the laser is improving circulation to and through the area, and it's also helping those cells function effectively. So that's a really good one. You then have other more invasive ones, things like prolotherapy, which we touched on very, very briefly yesterday, which is basically the injection of oxygen-free radicals into the area to help with the healing process. We've got stem cells and we've got platelet-rich plasma, which are again regenerative medicine category treatments, which will help improve the healing of that area. They obviously vary quite dramatically in prices and in complexity, but they're all things that make sense when talking about dealing with these sorts of issues. You do have also shockwave can help a little bit. That's more tends to be done on the things like the plantar fasciitis, but that's not a bad one either, and there is some good research in certain areas. I think it's the Achilles as well as the plantar fasciitis where those sorts of therapies can help. Then we get to the things that you want to avoid, and you've probably already guessed it by now. Steroid injections would be one of those. It's going to impair that local environment. There is lots of research that shows that yes, as we mentioned yesterday in the live stream, it does reduce the inflammation because they are anti-inflammatory drugs. They do what it says on the tin, but they are going to have a negative impact in the healing and recovery of those tendons. So we want to be very, very, very mindful before we do those things and have a very good discussion with your recommending physician if you are recommended for those procedures. Why am I having this? What about other options? And can you please convince me that this is the right way to go, potentially? Or convince you that maybe actually it's worth thinking of something else instead. The next thing is immobilization. Now, I want to be very careful about mentioning immobilization in the context of these injuries because yes, a short period of immobilization is going to be helpful just for a few moments so we don't further injure it. But it is very clear that actually getting these to gently move, again, getting these tendons to gently move helps with circulation. So that's coming back to providing more nutrition to this area, or if it's the hamstrings or any other hip tendons, a little bit of movement is going to help them remodel and figure out where do we need to lay these new collagen fibers down so they support the appropriate functioning of this tendon. Remember, at this phase, the proliferation phase, and even as we move into the remodeling phase, although the tendons are lined back up again, there's still abnormal structure and smaller diameter of these collagen fibers or microfibers. So we do have a little bit of decreased strength. And this is why I go over to the stretching of the calf. Getting back off that run or starting doing some aggressive stretching with a whole body weight going through that calf to try and stretch it out and put a bit of movement through the tendon is a little bit too much, whereas just simply moving the tendon is going to be helpful. So maybe we're just pointing the toes or just doing a little bit of that And that sort of movement is going to get enough movement through the tendon, but not too much force to the point where we're actually creating more harm than good. And this is again why when you're talking about back pain, we get a lot of you guys to get up and move around, even though it's a bit uncomfortable. There's other complexities that we've covered in other live streams about the complexities of getting you upright with back pain and those holes, etc., where the nerves come out. But we want you doing a little bit of movement because it does help the healing process, and extended periods of immobility are definitely not helpful for these tendon problems, so be very careful of that. That is pretty much it. The one last thing I'll finish off with is a nice little story of a lady that we had in the clinic, really active young lady who had a hip problem. It was the front of the hip tendon associated with some back issues, and she was very good at stretching and doing all the necessary work, really on point with that. She'd had this hip issue for about a year, some back pain with the hip, front of the hip pain. So we're talking about possibly a bit of psoas involvement, possibly a bit of rec fem and sartorius. So those are the muscles on the front of the hip. They attach just on the front of the hip joint. Some of those all run very close to it. And she would stretch. And what we said to her is, said, right, stretching is off limits. You're not allowed to stretch anymore for the next 2 weeks. No stretching. You can go to the gym, but no stretching at all. You do the other rehab stuff, a lot of it very similar to many of you in the Back in Shape process. And lo and behold, over the course of the few weeks, her hip pain more or less evaporated and vanished. We were still dealing with the back issue, but she was aggressively over the top stretching the front of that hip, stretching that tendinitis to try and stretch it out, and it was just creating more trouble. She was very diligent with the stretching that she'd been given in the past, but just too much. We're pushing those tendons too hard. Sometimes we need to back off a little bit, which is why we talk to you in today's live stream in particular when it comes to tendinitis. Leave it alone, stop touching it, stop pulling it, do some work on the muscles, which is what we did with the vibration, etc. Maybe you got the benefit of getting something like laser or some of the other cool therapies involved to help speed up that recovery. But leave it alone, do some work on the muscle, keep it moving a little bit, and it'll go through the natural healing process, and you're going to be a-okay afterwards. So that's pretty much it. We can get into Q&A.
Okay, brilliant. Good morning, everybody. Yes, please do pop your questions in the comments below. I did want to quickly ask you about that hip tendon.
Yeah.
People often complain about that tendon flicking, especially when they're in the gym, they're doing exercise. Is that something to worry about?
No, generally we get it a lot. One of the big exercises in the phase 2 of the Back in Shape is going to be those dead bugs. And as those legs are going out, quite often we get that, it's generally going to be one of the rec fem tendons, so one of the tendons that attaches right on the front of the hip and just creates a little clicking sensation. It's not a problem as long as it's not painful. If we start getting pain associated with that, then we do want to take stock and see, okay, what's happening here. But quite often, as a little test for you, if you play around with the direction that you're moving, with how you're making that movement, you'll find that a little bit of rotation of the leg, a little bit of moving the leg in or out as we go out can really make a big difference, and you'll find it won't flick. The same as the shoulder. If we move the shoulder in certain ways, it won't flick. If we move it in bad ways, I used to obviously do a lot of swimming, so my biceps tendon in here is absolutely, or the ligament that holds the biceps tendon in place is shot to pieces, so my shoulders click and pop. It's like a band in there. It's very not good, but it's not painful. It's just quite disconcerting. So in a lot of cases, these tendon flicking on the front, it is a bit shocking, but it's not really that much of a big issue.
Okay, awesome. Alex Vesco has asked a few questions here. He said, would you say that a post-exercise stretch should follow a massage first?
Whether a post-exercise stretch before the massage?
Should follow a massage first. The massage first and then stretch.
Okay, yes. I personally, after doing a harder workout, a little bit of mobility stuff just to move is okay, but doing my stretching stuff to improve the flexibility in those muscles, I do like leaving that away from those workouts, especially if it's been a heavy workout on that particular area. And I would say that yes, I will normally use that vibration gun before I do any sort of stretching. Most of the time, probably 75-80% of the time, I will do the vibration work on the muscles before I'm going to stretch. Massage is going to be very similar. Doing that work to make the muscles more pliable before you go and deliver a stretch is kind of, it just makes sense. And I think you know that when suggesting that, but it's very helpful for a lot of people to know that, because it sometimes people just overlook those sorts of things.
Okay, so massage first, then go for the
Correct.
stretching. Okay.
And I wouldn't say it's imperative that you do those immediately after the workout. I would say that doing the massage and then the stretching is very helpful to do close together, because you don't allow things to tighten back up. So that's definitely one for you. But I wouldn't be overly concerned about making sure that you finish your workout at 11 o'clock and at 11:01 you're in the massage room. Don't get too worried about that.
Okay, brilliant. And he also goes on to ask, does the same principle apply to ligament injuries?
That same massage-based principle. With ligament injuries, I think they're a little bit separate, because you're not really going to be able to massage the ligaments, etc. So I would say that would be a little bit separate. Okay. Personally.
Okay. Kate has asked here, which muscles would you massage with a tendon problem in my wrist? I have been doing the hand wrist rotations, icing, etc. But it is there. But is there?
Do you mean?
But is there anything else I can do if it's still inflamed?
That was Kate, right?
Yes.
Yeah, so if we're talking about these wrist rotations, like going around in circles, I probably would leave that out. And the reason I say that is because we have the flexors and we have the extensors and we have the adductors and we have these ones. I forget which way around they are. Anyway, we have these ones and these ones. So ulnar and radial deviation. Those are the main movements. If we start going round in circles, these tendons are going to be kind of pulled in different ways. Yes, you've got things over here that will hold them in place, but I would be more inclined not to do circular motions with the wrist. I'd be inclined to stick at pure movements, left, right, up and down. That would make more sense to me personally. Now, I wouldn't force it. That might be a little bit over the top, especially if it aggravates the tendon. It's maybe a little bit wrong. Where I would be going is down here. So working in these bellies here. If the pain is primarily, and I do forget, Kate, so forgive me there, but if the pain is on the front of the wrist here, we want to really hit these guys here, probably up to about there. You can feel generally where the muscle starts to become more tendons. Once we get down to the wrist, sort of this area and above, it really is mostly going to be tendinous structures. So that's definitely one to do there. A little bit of ice on that area, a very, very short period of time can help. But working on those muscles down there is going to be where you want to shoot. What might really be helpful is just go on Google and type in forearm anatomy or forearm anatomy netter, and you see a very nice diagram of basically the muscular structure of the forearm, and that'll give you that visualization of what's under your arm and where you want to hit. But it'll really highlight to you where the muscle bellies are and where the tendons are, and you just want to steer clear of those tendons and get working on those muscles. That's going to be the best option.
So I was just going to ask, would you go higher up towards the elbow, like in that?
So as we're going up here, there would be some benefit to work on the extensors as well, because if the extensors are working overtime, they're going to be pulling you back like that. So doing work on the whole forearm is going to have no issues whatsoever for you, Kate. I do think it was more on the front, but I might be wrong there. So basically, go down there, past where you watch, or if we take my watches here a little bit, come down. Anywhere below there, you're going to go okay, because I do believe it was in the wrist up here.
Yeah, she said the front of the wrist.
Yeah, so follow that. A little bit of massage work, light massage work. I forget, okay, if you've got one of those little gun things, but using that would be okay as well. Don't do too much. And if you're getting pain in here afterwards, you maybe overcooked it a little bit.
And just because we're talking about wrist, people that are doing a lot of typing at the moment, working from home, should they just be doing the same thing, kind of rubbing and massaging?
Yeah, bear in mind, we discussed on this about returning to work from lockdown or returning to work after an injury the other week. A lot of you guys that haven't been doing that word processing, as you get back into it, you're going to be doing a good bit of hard work on the computer. A little bit of work massaging those muscles is going to be a helpful tool. And maybe try not to just bang out a whole day straight in front of the computer to catch up. Try and take those regular breaks if possible. Intersperse some phone calls so you're away from the computer. That'll help.
Okay, a couple more from Alex. He said, sorry, I phrased the question badly. I mean just moving joints to allow proper collagen layering post-injury. This actually might be this might be on the back of his other comment, which said a bit off topic. Is there any merit in gentle twisting exercises for the spine? I remember from when I did yoga that it felt nice, but perhaps not good for the back. And then moving the joints to allow for proper collagen layering post-injury.
So I do think you want to be going through some good ranges of motion. You want to test. So you talk about that treat principle. So if we are trying to recover from injury and we're actually feeling fundamentally quite okay, some gentle rotations are going to be no problem. Look, you're going to have to rotate at some point. I know, Alex, you're doing the climbing and things like that. So you're going to be rotating at some point. Why not do some gentle rotations in a nice neutral position, just to really allow yourself to just feel what that feels like, feel if there's any vulnerabilities there, nothing extreme, but in a nice neutral position, going through those rotations is not going to be an issue. And yes, taking these joints through those full ranges of motion is going to be helpful. We obviously want to be mindful if there's a lower back injury inside there. We want to be a little bit cautious about full ranges of motion in maybe flexion and extension, but a little bit of rotation through the spine is not necessarily going to be a bad thing, and that's something that you're doing in those abdominal rotations anyway later on. So there is definitely credit or credit in the statement that we need to be doing a little bit of mobility work to just make sure these ligaments and tendons are laying down the appropriate levels of collagen in the right directions.
Okay, awesome. Alex, I really hope that answers your question.
Yeah.
I was jumping around a little bit there,
Yeah.
so I really hope that helps. Kate said, fabulous, thank you so much. Awesome, Alex.
But
thank
do
you.
stress, it's not end of range. All too often we see people, especially when it comes to back pain, they're trying to fold you over into a sandwich or something. It's way too far. It's at the right time we want to be doing these things. Very, very important.
Okay, brilliant. I think that is everything for today. Yeah, awesome.
And it's also one final thing on that. It's mimicking the stretches and the strains that structure is under. So we have to bear that in mind, especially when we're thinking about the spine in particular.
Okay, fabulous.
All done?
Yeah, that's everything.
Lovely. Well, thanks so much for joining us, guys, on today's topic. I know it's a little bit different for many of you that join us for back pain, but hopefully there's been a little bit of application there to some of your injuries, and hopefully it's been really, really helpful. If you do find these live streams useful, then please do consider subscribing to the channel. We do these live streams every single weekday. Obviously, we always do the Q&A to help you guys at the end. We've got the live stream coming from the clinic tomorrow morning, so we're going to be in there with the whiteboard. It should be really, really good.
Talking about minimizing degeneration in the spine.
Yes, that was very, very good. Yeah, we're going to be talking about minimizing degeneration in the spine. So hopefully that's going to be really, really interesting for you guys. So do join us tomorrow if you're around. With that being said, have a great day, and we will see you tomorrow with another live stream. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.